we know that about 50% of us would consider moving if there were attractive options for us. The thing is, there aren't. I'm one of them. I'm still in an overly large home. Very glad to be here, I must say, at the moment, with a garden to keep me occupied. So when we talk of housing for older people in the UK, we tend to talk of specialist housing. But we also know that most people want to continue to live in a mixed age community. So again, both our speakers are going to focus on that today. So I'm delighted to introduce our two speakers. Ian Spero is the founder of the Agile Aging Alliance, which aims to demonstrate innovations in technology, business and service models to create smart, age-friendly homes and neighbourhoods, and multi-generational neighbourhoods. Ian's also leading an ISO working group to establish international standards for multi-generational neighbourhoods. And he's a leading, and he serves as the monitoring officer for Innovate UK. Our second speaker, Liz Loughran, is the managing director of Line Planning, and she's dual qualified consultant in planning and law. And she brings planning strategy, health and wellbeing together, and is contributing to proposals for reform in housing and design in a draft bill. So without further ado, I'll pass you to Ian Spero, who also you'll see on his slide that he has next Wednesday, the 27th of May, Ian has got the, is it the 6th or the 7th Congress of the AA? And if you're interested, he's got fantastic capability for up to 10,000 people to be part of this online Congress next week. So on the slide that will be there while he's talking, you will see the reference that will get you into his conference if you want to join it. So over to you, Ian. Thank you.
Thank you, Janet. And good afternoon, people that I can't see. But I will imagine you in a room. And what am I going to talk about? Well, I was asked to give some consideration to age-friendly housing in neighborhoods that are, let's call them user-friendly. And in order to be user-friendly, they really do need to be multi-generational. How do I get to that conclusion? Because in brief, the Agile Aging Alliance is the byproduct of some work that I undertook originally for Innovate UK back in 2013, looking at new technologies that will keep people in their own homes and independent for longer. And the byproduct of that work is what we have today in terms of the healthy aging industrial strategy challenges, which are endeavoring to give people 5 extra years of healthy life. The problem within that context, as I learnt, is within the whole of Europe, but the UK specifically, the housing stock is not fit for purpose for an aging population. It's close to 80% of the housing stock is not fit for purpose at a physical level. So consequently, as Janet was saying earlier on, when you've got a lot of older adults who are remaining in their own homes, it does throw up some challenges because those homes, many of them need to be retrofit, modernized. What does that look like? Well, in reality, nobody really knows what best practice is when it comes to regeneration and retrofit. But then taking it to the next level, we were recruited as the Agile Aging Alliance to conduct some research for the European Commission amongst European stakeholders. And what we learned is if you create an ideal scenario, let us say, where you design a home which is perfectly suited for an older adult, let's call it an age-friendly home, i.e. looking to the future, and within that home, you introduce state-of-the-art technology, sensors, monitors, everything that you hear about today, but actually think about adding another dimension of artificial intelligence, etc. And what you potentially end up with is what I call a technologically gilded cage, where an older adult, like my mother-in-law, for example, in her early 90s, would not want to leave the environment because actually she's scared to go outside, because the urban environment is not appropriate for older people as well. So what I'm getting at here is you can't just look at the home in isolation. You have to look at it as a wider challenge and an opportunity. And if in that context, the program that we run is called Neighbourhoods of the Future. We've published 2 white papers. The most recent, I call it a white paper, but actually it's 350 pages. It was launched at the House of Lords last year. And it talks about the different dimensions that need to come into the whole idea of an age-friendly neighbourhood, which touches upon planning, of course. It touches upon design. It touches upon health and social care, etc., etc. It's a large can of worms. And what we learned, as I was about to say along the way, was there are too many examples of urban ghettos, especially in America, where retirement homes are designed, retirement communities are designed for older adults, with maybe state-of-the-art health support, but actually the older people become isolated and they need to be part of a multi-generational community. And we have the research that backs this up. So as Janet was saying, the long and the short of it is, I was approached earlier this year by ISO with a view to looking at the creation of a standards framework for multi-generational neighborhoods. And the work has begun. We've got the basis of a framework that has been approved by a technical committee. It's all very technical. And we are opening that up to wider consultation with a wider audience next Wednesday. We've got 40 stakeholders from around the world. We're starting off in Australia, we're then going to China and ending up in the USA. We do have capacity because fortunately we're not working on a system like this. We're working on a professional Microsoft live platform, as it's called. So we do and can accommodate some more people. We've got 500 as it currently stands. So if you're interested, there's a registration link on our website where we'll take you through to be able to participate. I think that's it.
Okay, thank you very much indeed, Ian. We've not got any questions yet, so hopefully everybody will be thinking about questions as we carry on, because we're hoping very much to hear your views on this. So Liz, can we start? Can we pass to you then to carry on with your?
Yes, sure. Welcome everyone.
If anybody's joined before I I introduced Liz at the beginning, but I think a few people have joined since we started. So if I can just briefly say that Liz Loughran, who's an academician and who responded to our request for academicians to come forward with ideas that they wanted to discuss at these lunchtime webinars. And Liz is a dual qualified consultant in town planning and law, and does a lot of mixed age schemes. So over to you, Liz.
Okay, Olga, can I just establish, are you running the slides?
Okay, yes, just give me.
Okay, thank you very much for that introduction, Ian and Janet. It's a great opener to start with the international perspective. And I've been involved in housing schemes and neighbourhood planning, but at sort of city end for quite a while. So if we move on, Olga. So I've divided my presentation into 4 parts. What we're looking at are health and wellbeing imperatives that are linked to the planning system and what we can learn from COVID-19. The supply of housing and demand for different housing options, which feeds into the neighbourhood planning concept that Ian was talking about in our case for action now. And then moving on, giving a few design exemplars as illustrations of what can be done. And then moving forward, how we devise a strategy and what scope there is for innovation. So taking health and wellbeing measures, as Ian was saying, it's very much an international movement building up, and we have lots of new strategies coming from different parts of the world, including Holland, Germany, Singapore, and London itself. And these strategies are actually being built on data that has been built up by the World Health Organization, who set a target that every one of us should have an added further 5 active years to our lives. And also, as part of that, we need to address exercise and isolation, as Ian was explaining, and that spills out into how we shape our neighbourhoods. Although I'm not going to really focus on multi-generations, the earlier end, I just want to say that the issue of mental health is a really important one, because actually, although older people do suffer from mental ill health, it's the highest in the 16 to 25 year old group. And that's why we've got to address things from a neighbourhood perspective. We need more cohesive societies, we need them to be enriched, and we have to look at how design and planning, housing and care can be joined up. So, next slide, Olga. In terms of the different COVID-19 accelerator factors, what we know in England and many parts of the world is that care systems and care homes are overlooked and undervalued. And what we all need are longer term care plans that build systems that prioritise intergenerational needs. So basic stuff like we look at our homes, can we work from our homes comfortably? Well, for many, especially in England, we have lower space standards than the rest of the world, and that creates a challenge for working from home. And equally, if we're all going to live longer, and we're going to be in our homes for 30 years or so after the age of 60, we need to be having more ready access to health and advice systems, which can be facilitated through telecare. In terms of neighbourhoods, we need to have more accessible and friendly neighbourhoods, and that's all about reducing pollution and addressing climate change standards, and how we reshape our neighbourhoods in response to that. And there's a lot of neighbourhood planning examples going across London, which I can talk about later. This also links to our own health requirements. So the World Health Organization has suggested that each day, all of us need to do a minimum of 10 minutes of exercise a day, and on a further 5 days in the week to exercise for a further 30 minutes. So that's quite a lot of exercise for those people who aren't generally used to it. And we all need to consider how families can come together. How does it affect family structures? And again, that feeds into the concept of how we care for our neighbourhoods. So this is an example of a pie chart from the Oxfordshire County Council Market Position Statement, which just illustrates, it was only published late last year, it illustrates that 77% of older people are in their own homes, and they plan to stay in their own homes until for the rest of their lifetimes. And also illustrates what the cost of that might be in the current housing. So the NHS are reporting that if people do, that could add on a 1 billion cost to the NHS bill. arising from inappropriate housing. And as Ian was saying, in England, we particularly have a major problem with having very old housing stock. So 38% of it was built before 1946. And a lot of it still doesn't have the required insulation and energy standards that we seek to meet, and standards that have been more recently set out in the last 7 years. So what are the opportunities and risks attached to all this? Well, one risk in London is that we might actually see an exodus of older people who can't afford to stay in London and who will then be moving into towns. So Knight Frank have actually said they want to open up the middle market, they call it, for older people, where there's cheaper, if you like, cheaper land value, so cheaper houses to move into. And but what will that do to the structure of our families, and you know, the effect that it has on society in general? Is that a good thing or a bad thing? My own view is that older people should be able to stay in London and live a comfortable life and be part of their neighbourhoods, and that must apply across all international cities and towns indeed. In terms of the planning system, we have a real focus on just concentrating on what we call 5-year land supply figures and what the housing targets are to meet. So when it comes down to assessing what the older people's needs are for that, that is really going down towards the middle or the bottom of the pile, because our planning system is too driven by targets and less so by quality. That's also having an effect on how we treat our young people who are being marginalised from public consultation and not being able to have a say in their own futures. There's been some great work that's been developed by an organisation called HAPPY, which stands for Housing the Ageing Population and the Panel for Innovation. I think these are pretty well known internationally. Ian can confirm that. And these standards are incorporated into homes that are specifically devised for extra care and sheltered housing, but haven't yet been adopted into mainstream planning design standards for all generations. So I just wanted to give you a few examples that are award-winning examples of where this might take us to in housing in particular. And there are lots of examples over the country. This one has come from Staffordshire, and the architects were PRP. It's a small estate of 75 apartments, which is exceptionally unusual because all of them are for affordable housing. And this issue about affordable housing has created quite a lot of tension in terms of the management of housing for older people and how we forward plan in future schemes. A second example is how Greenwich Council then encouraged developers to come forward to work across a number of very small sites, but devising planning for older people in 35 units. So, you know, you've got 35 units divided amongst 8 sites for social housing and age-friendly housing. That's the kind of thing that I think we'll have to move on to, particularly in London and major cities, where there's a pressure on land, and it's rare to get pockets of land coming available for regeneration. Those larger pockets tend to be assigned to what we call mainstream housing. So that's just an example of what kind of, you know, how good design principles look. So they need to create light, airy places. They need to be welcoming. They need to have flexible spaces so you can flip rooms or spaces around for different needs. And this is another one in Salford, which is outside Manchester. Again, it's housing association led, but it's been inspired by the council for 70 extra care units, which are 1- and 2-bed apartments with dementia friendly units incorporated in them. And of course, for those people that suffer from dementia, there will be extra care nursing on site for them. So this is just as a technical slide giving you some figures about what the housing targets are in London itself, but drawing your attention to a requirement for 4,000 specialist housing units under C3 for sheltered, and 872 extra care home beds will be required per annum over the next 5 years in London. So how do we move on to getting better neighbourhoods? So London Plan policy is actually going through a sort of renaissance in terms of neighbourhoods, but we're only slowly creeping forward. And one of these is that the Mayor has now, well, has introduced into his new London Plan, which should be published in the foreseeable future in the next 3 months, a policy that requires London boroughs to collaborate with local communities to ensure support for the creation of inclusive neighbourhoods. And alongside that, the Secretary of State has responded and said that the Mayor of London should now publish new consultation requirements for protected groups, which include older people. And we need to be actively feeding in alongside Ian's effort for the ISO standards. There is a particular London Plan policy for housing for older people, which requires providers to identify suitable sites. But I would say alongside that, that providers should include members of the community and indeed neighbourhood planning forums or neighbourhood groups, whether they're designated or not, to be able to put forward their own ideas about housing schemes that cover the different generations and how we want to share spaces together. Now, we have a very siloed system, as I was saying earlier, so care commissioners aren't generally a part of that planning process, and that's where we need to join up those gaps. So we do need care commissioners to feed in what our planning for the future should look like in terms of the housing requirements and design principles. And Public Health England have really stepped up in the last year to say they want to be involved with this. So what we're looking at is creating more local neighbourhood centres for a whole range of services. And that could include teleservices like Ian was saying about localised sharing economies for peer-to-peer purchasing. But also what it must include are new green spaces for our well-being, because we all know that our well-being is linked to good mental health and outdoor relaxation. We need to think about joining up spaces more between play space, parks, streets, perhaps taking over some streets for parks. And Mayor of London this week has announced he's going to widen our streets for more cycling and pedestrian use, in view of the fact that public transport options are severely curtailed due to the COVID-19 experience. So in terms of intergenerational planning, there is a market for retirement villages in this country. The market is particularly geared towards out of London, is particularly well placed for that. But some people don't want to go to retirement communities because they want to stay in their neighbourhoods. And so an alternative community groups are forming. And this is one, it's a meeting in the old Holloway prison site in Islington late last year, where people got together to discuss how they could create a co-housing group in the centre of London for this large redevelopment site, which is being redeveloped by Peabody, which raises the issue, how do we get criteria that requires very large developers like this to work with smaller groups so that we can all innovate together? And we have examples of that. I mean, in terms of our co-housing groups, we have 60 groups only across the UK, which is too small. And again, the Mayor has stepped in and set up a specific housing hubs to help co-housing groups expand. And one of these is called OUCH, which stands for Older Women Co-housing Group, which was specifically aimed for women who wanted to get together over 60 and live in an alternative kind of shared environment with some shared facilities. And these design principles about having your own apartments and then sharing some communal facilities were started off in Scandinavia and Germany. There are lots of examples that many of you might have visited around Europe, and they're just beginning to come into England more, but it is a slow slipstream. And it's about reframing how we see our amenity uses and what we can do with sharing. I'm looking forward to moving on with that. So we know that creating new neighbourhoods is about addressing health very fundamentally, and we want to reduce health inequalities, which has been a particular aspect of highlighting this issue during the COVID-19 period. And in the top right-hand corner, you can see this is a photograph taken in China of a group of older people who regularly take part in Tai Chi throughout their cities and towns. They come out at sort of 10 o'clock in the morning, do their Tai Chi, and then sit together for an hour afterwards. It's not compulsory, but people feed into it. They get a lot of benefit from being part of a recognised group, and Tai Chi is great for balance and well-being, and that needs spaces in parks. So separate from the play space we talk about for children, we also need space for organised activities for older people in parks, as well as our outdoor gyms and so on, which is for all generations. And alongside the innovation that we need in planning and care, we need to put together a whole suite of interventions that look at how we address our financial planning for those changes. So in conclusion then, what we need to accept is that we need to work on our systems for public participation. This has been recognised recently in a reform paper called the Rainsford Report, which is going to feed into a government white paper which is due out in the next 3 months or so, and make more age-friendly housing part of national policy, which it isn't as yet. I'm currently working on a Healthy Homes Bill, which is designed to make, as part of the statutory framework, housing principles become enforced through the statutory system. We've had too many bad homes created through permitted development rights, or substandard housing created by housing developers that haven't respected those principles. And also look at the scope for changing areas through things like area action plans. I've given a couple of action plans here by way of examples, one in Kent to do with Chiltern Green in Ashford, where a statement of intent to developers has been set up as a kind of charter for setting the parameters of what developments should be looking like in the future. And also in Southwark, we have a very exemplary Old Kent Road Area Action Plan, where there's a whole section devoted to healthy, active lives. And looking at that guidance, they have particularly focused on joining up green spaces and creating something called an inner green belt to combine spaces so we can avoid roads with traffic on, that we can cycle easily north and south and east and west of the borough. So it's been fantastic talking to you all. I'm looking forward to your questions, which is the next slide. I personally think we all need to have 10 principles for positive ageing that underpin the health, housing and planning system, and join up those systems together and use them as a checklist for looking at how we are achieving those outcomes. And we need a new set of metrics to assess them against. So I'll conclude by saying we do need to combine all these things in some kind of social impact assessment, and there may be examples out there in the wider world. I know some of you are from a range of countries joining today, and we'd love to hear from you. Thank you.
Thank you very much, Liz, and thanks also to Ian earlier. We've got quite a few good questions here, but before going to those, just to reflect on Liz's plea for more co-housing schemes. Ouch, the Older Women's Co-housing Scheme in Barnet. It took them over 8 years to get that scheme going. It's still so hard to get these things off the ground, although there's a huge amount of appetite for it. The amount of people, you know, I'm in that age group now where everybody's thinking, what do we do with our older lives? How do we live well? And massive appetite that is just really difficult to reach. I'm going to start with the first question we got, which is from Torben Brandy Nielsen from Denmark. And Torben is asking us about, talking about the risk of loneliness. So Torben, can you turn on your video camera and unmute yourself and ask a question to both of our speakers? Thank you, Torben.
Yes, thank
okay.
you. Yes.
Like to ask your question.
Hello, I'm Torben Brandy from Aarhus in Denmark. When I look at this item about loneliness, it means more and more here in Denmark. But we know that loneliness means more than smoking 15 cigarettes a day. Much more people die of loneliness. But when developers are building some new buildings, they say, how many square meters can you build here? They are not building to have a bench to meet on or whatever might be the solution. There's been they asked people here in Denmark, how many of you do want to live in co-housing? It's around 80,000, a little more than a percent of the total population. And it's only elderly people who have been asked here about living together. But in 3 to 5 years, they estimate that this demand will raise with 50%. So we have a tsunami in front of us asking for these developments. We can say we want to do it. We heard you saying a little while ago they had done this for 8 years for one project, but we have to do something for many people. So that's my question here. We need a strategy change here that really means something. Yes.
So, Liz, do you want to go first, and then I'll ask Ian?
I'm happy to come back on that. And I know exactly what you're talking about, Torben, because when I travelled around Denmark, it was some time ago, but what I noticed about Denmark is you have a very intense, dense hub around Copenhagen, and then you have Aarhus, and then the rest of the country does feel that there are quite a few towns and villages that are quite small and can be quite disconnected from Copenhagen. So I think that leaves a particular structural planning issue for your country. On the particular point about isolation, what we have to also take into account, in addition to the increase in smoking, is that the divorce rate in England and the UK at least is rising quite a lot amongst those in the 50 to 64 age group, which means that more people will be living on their own rather than as a couple. And the demand for neighbourhood housing and communal facilities, in my view, is going to rise as a consequence of that restructuring. And that's why we need to sort of work across different levels, both in terms of housing design, neighbourhood design, but also in terms of looking at the health impacts and what we can devise as communities. So very good things have emerged during the COVID era about sharing stuff over Zoom, but that actually cannot equate to being part of a physical group. We are spending time with each other and sharing experiences. And you know, that should be facilitated in a better way, and in a way that goes beyond our cafe society. So if you look at Paris, for example, which is very reliant on cafe society, that might be something that older people just simply can't afford. I don't know what you think, Ian.
Old people in Paris can afford cafe society. I think it's pretty much, will cafe society ever come back in Paris? That's a good question, full stop. But I think bearing in mind my wife's Parisian, so we spend a lot of time over there. I used to live there. It's there are people that actually find comfort, perhaps because they don't have that proximity at home. They meet in those cafes, and they're older people. They've got time on their hands, and that cafe is an ideal environment, maybe even to sit outside, which would be appropriate in this day and age. But I think that that's a very good example, cafe society, but that also is about locality. So in France and in Paris, cafe society is part of the culture. You take Denmark, and you referenced your trip there, so I have to throw in the fact I used to live there many years ago. In fact, I was a DJ there, and I had a house on the beach, but I also started off in, is it Uland, is it pronounced? The mainland, and absolutely, it's very isolated for young people or for old people, but that's just the way it is. I quickly got myself to Copenhagen and discovered the beach and loved every minute of it. But that's an aside. I think that the real answer to the question is, if you're thinking about new build, well, yes, there is a need to take account of, as I said earlier on, the external environment, to create public spaces that actually lend themselves to older adults relaxing, but also, more importantly, a place where you can potentially socially engineer connectivity between older people and younger people. Now, we do this on social media, we do this artificially, and can do so, and that's not necessarily a bad thing. In reality, just because, and it's true, that social media has led to a breakdown in society, has led to some part to loneliness, there is still an argument that could say that technology has an important part to play. But creating the technology that older adults can embrace, and also remembering that older adults today will be very different to older adults in 10 years' time, because they've grown up in a Facebook context, they've used social media, they will take, you know, that they will have their Alexas at home, they will be more comfortable in a situation, and there will be apps, there will be devices that connect people. So there's a technological opportunity and a challenge, but in terms of the physicality, in order to achieve what you're looking for in regards to people coming together to avoid the stigma of isolation, it's a combination of stakeholder interests. And that is always going to be the problem, because people in their professions operate in silos. If you're in planning, you're thinking about planning. If you're in design, you're thinking about designing the buildings. We have embraced different stakeholders at different levels. So for example, one of the big challenges that architects have to address is defined by the Bartlett Real Estate Institute, which is part of UCL, which is the leading school in the world for architects. And the point that they make is architects in their 20s design for themselves in their 20s. They're not designing for their older selves. So there is a need to start at the education level, to have architects and designers thinking about the future of housing, and to develop universal design or reinterpret universal design to take account of the capability of modern methods of construction to be adaptive. So at the moment we're locked into the construction processes of the 18th century, 19th century, bricks and mortar, but there are the new construction methodology and the new technologies that can go with that will allow adaptive homes that can actually change over a lifetime. And in that regard, people don't necessarily have to move on. There is an opportunity for family to coexist. So I think you'll see more in the way in the future of a kind of Southeast Asian approach where you have families remaining in closer proximity, as indeed you find in Italy. But because of what the Italians suffered through the epidemic, pandemic now, there will also need to be considerations given to proximity and to public health. But I think that the bottom line is what you need, and this is what we're attempting to achieve through these standards, is clear definition of what best practice is. And the only way you're going to get that best practice is through collaboration.
Thank you, Ian. Thanks a lot. We've got a lot of questions. So I think because we're probably not going to have time, we've got 15 minutes left. I think we'll need to be a bit snappier with the questions and the answers so that we get a chance to get more of the questions in. So just to respond to some of the points that Ian's just been raising, we've had Asia Abunza has raised this issue of mixing older people with children, which those of you who've seen the the 4-year-olds with going into the care home on telly will have absolutely loved, and talking about mixing playgrounds and exercise machines with older people. Obviously, there's a real question in this COVID-19 world about how all these wonderful ideas can go forward. But let me go first. And Andrew has asked what size of development is a neighbourhood. So rather than go to Andrew, sorry, but I'm conscious, Andrew Burrell, so that's Andrew Burrell, that we've got quite a lot of questions. So I'm going to summarise some of the questions. So hang on to that one. I'm going to ask you what you think size of development. And Patrick Devlin, actually Patrick, let me bring you in here. Because you were asking, could all developments over 30 units include some happy standard homes for older people? And if I could ask you both to respond both to Andrew Bell's question about what size of development is a neighbourhood, and then Patrick, if you can come in, and if you want to add to your question, you would need to put
the answer is how long is a piece of string? For us, the reason that we're calling it neighbourhood rather than communities is because communities are perceived in this day and age as being virtual. So effectively, it's a cluster of homes that collectively can create a physical environment that you can build upon. So we're not really restricting it, but certainly 30 homes could start to create a neighbourhood. It's another name for community in that regard. And what was the second question?
Sorry, well, the first question was what size of development is a neighbourhood? And then Patrick, do you want to come in?
Yes, I'll come. So my question was, it was a little provocative, should all new developments include 30% happy homes? I actually think all new developments should be designed on happy principles. They are the principles of good housing, and they apply to all generations. And I wanted to just sneak in just a comment on multi-generational neighbourhoods. That's what towns, quarters of towns, villages, and quarters of cities have been. And we need to balance good work that we've seen today, actually, and other good work in older people's housing, to lifetime neighbourhoods and the World Health Organization principles for cities for all. And that has fallen away, alas, in policy, but it is, of course, the way in which we will continue to meet as a whole society, physically, socially, when we've worked out how to deal with COVID. And that seems to me that's the ultimate answer to the problems of isolation, which are massive.
So I think that the answer to your question is you've answered it yourself. The second part, anyway, I agree with you completely. It's the old approach, quarters of cities, communities, interacting communities. And I agree with you as well in regard to the World Health Organization. And as you must know, they have introduced a decade of healthy aging starting now. So the idea is to bring together stakeholders, national, regional, etc., to try and promote exactly what you're saying. Regarding your first part of your question, I think happy is one part of the equation, but at the end of the day, we started out with universal design. Now, universal design is something that's kind of got left by the wayside, and there are a number of practitioners that I've been speaking to who are thinking about kind of redefining universal design so that it fits what you're talking about. takes account of happy, but at the end of the day, the reason that I'm interested in this whole notion of multi-generational neighborhoods rather than emphasizing age-friendly housing is because let's not think exclusively about older people, because it's not. It's about inclusivity. And there are plenty of people with disabilities of various types that should take advantage of this. So the universal design is probably a bit safer, but it's kind of got lost in translation. So there's a guy called Paul Smith, who is the director of foundations, who's got very strong thoughts on this. He's actually giving a speech on it on the event next Wednesday. It's very specific to that particular brief.
Okay.
Thanks. Liz, do you want to come in?
Yeah, just from a planning point of view, neighbourhoods are generally defined by ward sizes in England. So that could be anything from, 4,000 to 10,000 people in the sort of zones 2 and 3 of London. But I also think it depends on whether neighbourhoods want to define themselves as neighbourhoods as well. So it's largely up to how people want to convene, where they see their own boundaries are. So it's really should be involving communities from the outset. And in terms of design principles, Patrick, I think your idea of having 30% of housing allocated to be specifically adapted to the requirements of older people is a good one, because at the moment we don't have a specific percentage, and indeed it's still a huge fight to get very large developers to make specific provision for older people. It seems to be the community always having to raise this rather than it coming from planners or developers themselves, because it's seen as an extra expense. But it partly goes back to the tension in planning about the provision of affordable housing taking a priority over everything else and getting the housing targets in. That's why we need to redefine planning and bring in a lot more planning reform.
100%.
Thanks a lot. We've got a lot of questions here, and I think we've only got 7 minutes left, so we're not going to have time to answer all of them. So what I propose to do is read them out. I'm afraid we don't have time to go back to more questions, although I'd love to have done that, and then ask the two of you to respond to some of those questions. So sorry, I'm just sliding down them. Richard Gleeson talks about the planning development system in terms of output is so far away from what's being opened up here. Planners need a powerful set of questions to interrogate poor planning proposals, which I'm sure you both agree with. So I'd like to get your comments on that, but I'm going to go on to the next question because otherwise we won't have time to talk about them all. Stefano Smith talks about, how do we share the learning about intergenerational housing between the nations and internationally? For example, the Housing Learning and Improvement Network, for those of you who know it, which is a fabulous thing that I've closely involved with. I'm on the London steering group, and other useful resources for intergenerational housing. And obviously he's also referring to Happy, which Rachel's now put the link to on the chat box. So those of you who haven't seen it, you can click on that link and get to it. Azia Abunzu, as I mentioned, has talked about the design, how we actually create intergenerational use with accessible paths, urban furniture, playgrounds for children in the same areas with exercise machines for older people, to reduce social isolation and get some interactivity going. Emma Sperin from Dublin wants to know how we distinguish between age-appropriate neighbourhoods and just good design that's inclusive to people at all life stages. She thinks there's a suggestion that older people should be partitioned off from the rest of the community, which I think is absolutely not what we're proposing, and talks about mixed communities with a range of unit sizes and amenities that would benefit everyone, including older people. And actually Emma, that reminds me of the quote from Enrique Peñalosa, which many of you will know, the former mayor of Bogota in South America, who did fantastic transformation of that city. And he says, children are a kind of indicator species. If we can build a successful city for children, we'll have a successful city for all people. And I personally think that's absolutely right. Sorry, I'm just zooming through these questions, asking to make sure that everybody's gets. Stefano Smith says, can community deliver quality intergenerational housing? And talks about the wonderful example of Marmalade Lane in Cambridge, which is a co-housing scheme and has won the RTPI Excellence Award. And can you recommend one outstanding case study that you think is a good example? And then coming down, we have, sorry, coming down to, Vanessa Ross says, can the ever-increasing drive for density and higher-rise developments in cities be compatible with multi-generational neighbourhoods? I think that's a really interesting question. And then Stefano Smith again says, if we believe it's good, how do we influence it and get people involved? And Emma Sperin has lived and worked in mainland China and Hong Kong. Well-designed density should support intergenerational neighbourhoods as there's more critical mass for health and so on. So I might not have got all the questions there, but can I now pass over firstly to Liz and then to Ian to respond to bits of those questions that you wish to, and also if you've got any couple of, but I'm afraid we've got very little time left now.
Yeah, okay, just very briefly, Janet, on the first question then about how we open up planning, I think the answer is that we must stop having too many private meetings going on between planners and developers, which are there, go on in sequence for months, and then all of a sudden there's a public participation exercise announced when all the major decisions have been taken. Communities need to get involved with how they want to shape their communities at the outset before proposals even come along and say what they want. So we really need the whole of society to be reorganised to gear up for planning participation in a different way, which is what Rainsford was recommending in his report that came out earlier this year. And that will then include intergenerational housing. In terms of architects creating designs that suit their requirements when they're in their 20s and 30s, what I would say to that is we need to include older people and in fact children much more in the whole public participation process, and actually in the offices of architects and indeed developers. There need to perhaps be more grouping, more facilitation of group discussions across the different generations with the private sector and the public sector involved. And I agree with Azio, it'd be great to have more urban furniture. One of the things that COVID-19 has highlighted, when the relaxation started on COVID-19, everyone in London, or not everyone, but a lot of people came out in London were desperate just to sit down on a piece of green space or get to the river, just to release the oppressiveness of lockdown. And you know, what we also need to go with that is more comfortable furniture, more seating, more public toilets, the greater ability to spend more time out of doors.
Liz, I'm really sorry. I'm going to interrupt you because I think that Olga and Rachel are very strict with their timekeeping, and they're going to close us down very soon. So apologies for that, but I'd like to have the chance to bring Ian in as well to give his responses to those questions before we run out of time. Sorry, Liz.
So very brief response. Planning, you need to engage the opinion formers. Royal Town Planning Institution, by way of example, they are really interested in this space, so they are part of our group. We'll be speaking on Wednesday. I'll let them speak for themselves. You mentioned Housing Lynn. I agree with you. They are leading by example. Jeremy, the director, who I know you know, Janet, is participating as well, because at the end of the day, he is one voice. That organization is one voice in a very big scheme of things. So what we're trying to do with this standard situation is to connect the dots to find other housing LINs in other parts of the world. There's talking about age inclusivity, which we were talking about before. Bottom line is it has to be multi-generational, not just about the elderly. Outstanding examples, there are not enough outstanding examples, so I can't answer that question. We need to create the outstanding examples. We need to find them and practice best, create and promote best practice. And there was a brilliant question in regards to density. This is something that I'm learning about in terms of the fit in the built environment. I'm involved with a group which is connected with America called AARP. We are about to launch some principles which are focused on density and fit in the built environment. They're draft at the moment. AARP will be talking about them on Wednesday, but they will be published at the end of June. So Janet, we can share those through your organization.
Thank you very much. Rachel or Olga, do we have a couple of minutes? Because I really did cut Liz off before she'd finished. Or
I'm afraid just a minute, but very,
okay.
very quick.
Right. Sorry, Liz. I was...
On the density point, there is a draft SPD in preparation by Tower Hamlets Council, which is in the East End of London, on designs for high density. And that's already very built up part of London, as many of us know. And I think it actually presents huge challenges. And in fact, what we've got to look at when we revise our space standards is also creating a more relaxed approach to green belt land. So we do appropriately redevelop some parts of green belt where there are already developments, but also develop perhaps on some land that could be incorporated into edge of settlement boundaries. So I think there are limits to high density and what people are comfortable with, especially for older people and younger people. And those issues, which also relate to our mental health, are major players as determinants of how we enjoy and live in those neighbourhoods.
Thank you very much, Liz. Thanks a lot. Well, thank you all very much for joining us today. We've only touched the surface of this topic, and I'm sure it's something that we'll come back. Well, we will be coming back to it again at the Academy of Urbanism. And I hope that those of you who got down the link to Ian's next event next Wednesday, because that's going to be a really good. He's got a wonderful agenda together with some great speakers, and he referred to his book Neighbourhoods of the Future. This great big book. Which is online, isn't it, Ian? So people can read.
Yeah, it is on their same web link as the event we gave.
So there's quite a lot of contributions from thinkers in that book, which are worth looking at. So I'd like to thank you all very much indeed, and pass over to you for is it Olga or Rachel who's going to mention the next webinar? Thank you very much.
Thank you for coming. I will be very fast. Our next Urbanism Lounge hour is on Friday, 29th of May. And we're gonna discuss during this session how streets are adjusting to COVID, how cities are adjusting their streets to COVID-19 physical social distancing requirements. We will have examples from Hackney and Auckland, New Zealand, and we have the speakers the Council, John Burke and Ben van Bruggen. Our coffee mornings in Scotland are every week on Tuesday at 11. And if you wish to see more about our online activities, please visit our website online. See you next week, and thank you very much for coming today and joining the discussion. Thank you. Have a nice day.